Okay, aloha, you guys. This is like our fourth time trying to do a live together with myself. I'm Dr. Gupta and Dr. Irene Papa Constantopoulos. She is a local pediatrician on Maui. She was a super athlete, Olympic athlete in Greece, and now we have her here on island. So I'm going to be adding her hydroxyapatite, nanohydroxyapatite. So I said, sure, I'm happy to do a live and we can do it together. Here she is, Dr. Irene. Okay, fifth try
This
is a charm.
is why I don't do lives.
Okay, well, go ahead,
I
introduce
know
yourself, ask your question.
our patients do. So yes, I know they really want the answer to that question.
Okay, well, let's start over. What was your question?
So what is the difference? Why would we prefer the nanohydroxyapatite compared to a fluoride toothpaste or the swipes that have the nanohydroxyapatite, especially for the little ones that are not, spitting, they can't spit out yet? And is one better than the other? That's the question.
Okay, well, that's a great question. So the formulation of both of them are very similar actually. And fluoride and hydroxyapatite both remineralize our teeth. If you look at, I think this might be backwards on the screen, which is such a bummer. But so this is the formula for hydroxyapatite. And this is a formula for what fluoride, when it goes in your teeth, it becomes fluorapatite. So if you look at a tooth, when you get a cavity, you're losing calcium and phosphate. And when we talk about remineralizing, we're trying to put the minerals, calcium and phosphate, back into the teeth. How do we get that calcium and phosphate back into the teeth? Well, in your teeth, it's in the form of hydroxyapatite, which is calcium, phosphate, oxygen, hydrogen. It's those four elements, right? So the formula looks like this. If you can read backwards, calcium, phosphate, oxygen, hydrogen, and this beautiful molecule is hydroxyapatite. I love it.
Back
I have
to
this
organic chemistry.
I love it. Yes. So, what is the difference between hydroxyapatite and fluorapatite, the mineral that fluoride forms? The difference is an O for oxygen and hydrogen, which makes it very biomimetic, same as your body. That's what hydroxyapatite is. You take those out and you put in an F for fluoride.
Okay.
But they're both crystals, and they're both crystals that help solidify those areas with cavitations, cavities, demineralization, erosion. And so, yes, they both work. Okay. The process of making them are totally different. Hydroxyapatite can come from bone of an animal, a human. It can be made in a lab. Nanohydroxyapatite just means it's a smaller particle size. So I've gone around the world looking for the kind of nanohydroxyapatite that I want to use. I wanted the smallest particle size that cannot pass the blood-brain barrier in a rod shape that's small enough to get into those dentinal tubules and remineralize the teeth. Can fluoride do the same thing? Yes, but then you have fluorapatite in your teeth. And when I had my baby, I only wanted stuff in his mouth that was biomimetic, biocompatible, the most highly biocompatible, what is already in our body, what's given to us at birth. So the formula is very similar. The molecular chemistry, the structure, how it works, the functionality, very similar. There's so many papers on fluoride and hydroxyapatite, nanohydroxyapatite now. It's all proven science. It's really what we can do, what we can use, and it's proven to work. And it's proven to work as well, if not better, than the other, right? So I usually tell parents, I know hydroxyapatite, nanohydroxyapatite is a little pricier. So sometimes the price is what makes the decision.
Yeah.
Fluoride is super cheap. So maybe it's not ideal for everybody because it's not as biocompatible, as biomimetic as hydroxyapatite, but it still works. And if you have a cavity, what I usually tell patients, parents, children, everybody is it's better to remineralize that cavity with whatever you have available than to let that cavity go farther. And it could turn into something like an abscess. Babies have died, as you know, from teeth abscesses. It's an infection in our body. And when we have an infection in our body, it's traveling through our bloodstream. So to answer your question simply,
well, as I tell parents, we're always doing something preventatively to prevent something that would need more interventions. So if it's fluoride that we need to give, or if it's nanohydroxyapatite. What do you think about toothpastes that have neither, that don't have anything? Because I try to tell them that we need either one or the other in the toothpaste, right? We can't just do water. We have to have one of those minerals. And in Hawaii, the water does not have fluoride, so we're really not exposed to getting too much of it. Do you agree with that? Like, the toothpaste should have either one or the other.
Okay, so if I can go back a little bit, a lot of it has to do with our diet. And like our diet now
Oh,
is
yeah.
just garbage. I can't find bread on the shelf in stores without sugar in it. I can't find crackers without sugar. I can't find anything without sugar. Even pizza crust has sugar in it, right?
Mhm.
So because our diets have changed, I think we need a remineralizing agent in that exposure,
Okay.
whether it's in the form of toothpaste, a serum. We make a serum, so it's like a little bit cleaner in my opinion. I actually don't like most toothpaste because they have a lot of sulfates in it. They have
Hmm.
triclosan. They have all of these other junk that we don't need. You
Hmm.
can brush your teeth. I've worked in Africa and India. My parents grew up brushing with a twig from a tree.
Coconut
You can
oil.
you can brush your teeth with anything, like just water and a toothbrush or water and what they call an mswaki or datun, and you can brush all of that plaque off your teeth. Now the problem is we have so much sugars in our diet that we need more abrasive action, and that's why I invented the swipes, because it was like a quick hack, right? I can use them on the go, I can chew on them, I can clean those little pits of the teeth. So I don't think you even need toothpaste to answer your question.
Oh,
I
okay.
think you can brush
Okay.
like baby's teeth. I would never expose my baby to any toothpaste on the shelf, because literally most of toothpaste is glycerin. It's a tube of
Hmm.
glycerin with some added elements. So
Hmm.
if you have fluoride drop, if you want to use fluoride, there's fluoride drops. You
Hmm.
don't have to use it, incorporate it into this formula, which is not necessarily good for you.
Which you're
I
getting
always
all
tell
the
people,
other
yeah, I tell
substances that are in the
people
toothpaste.
whatever toothpaste you want to use. If you love toothpaste, fine. Google every ingredient, learn about them.
Hmm.
There's websites that score them. I think it's called like ESG or EWG something. You can
Yes,
see the
I've seen that
toxicity
one.
levels.
Hmm.
And when you look at most toothpaste and the toxicity levels of those ingredients, I say, God, I would never want those in my newborn baby's mouth, right?
Hmm.
So I always just brush with water, and I used floss and just floss between. I avoided plastic floss because I just didn't want, because when you floss, your gums bleed and the plastics can actually get into your bloodstream potentially, right? So I
Okay.
just wanted to avoid plastics.
But the
So,
reality is that with whatever the diet today, but even I
yeah,
unfortunately see it may be what we're exposed to in general, and even the amount of healthy bacteria that we have. Like, we're even deficient as moms, we're deficient in the normal flora. So even babies that are breastfed a lot still with teeth, we do see cavities. We see this. So
yeah.
for those, let's say babies that are breastfeeding through the night, we want them to breastfeed. We should be adding either the fluoride or the nanohydroxyapatite so they just wipe them down afterwards. Do you agree with that? Because we just see those cavities,
Yeah.
right? You see them all the time.
So I think like hydroxyapatite, fluoride, they're all remineralizing agents. Our goal is really to prevent the cavity. Yes, it's
Mm-hmm.
great to use a remineralizing agent, but if you're just scooping down ice cream and soda and gummy bears, that
Yeah,
fluoride and
that's not
hydroxyapatite isn't going to do
good.
much, right?
Yeah.
So it's not. So really, what we want to do is get to the root of the problem. If they're nursing all night, that's why I made these, because I nursed all night, and my kid did not have a cavity. So I grabbed a little swipe in the middle of the night after he was done nursing. I just grabbed a little swipe, wiped his teeth
Hmm.
off, and then I was able to go back to sleep or do whatever I had to do, or give him some water. Like I had a bottle with water always, for if he's old enough to have water, and the pediatrician said it was okay. I just like give him a little drop of
Yeah.
water also. So the main thing is nursing, there's some sugars in breast milk,
Hmm.
right? And that's where the cavities start if they're left on all night. But if you're awake enough after your 5 million things you have to do during the day as a mother, then it'd be great if you can just swipe off the
Hmm.
teeth. But yes, in addition to that, remineralizing for prevention is great. Since my child got his teeth, I was using nanohydroxyapatite,
Yeah.
and we have a pretty healthy diet, but we splurge a little bit, and I was able to avoid cavities. But I was on it because I saw all of the kids that I saw at the hospital over 15 years our youngest was like 2 years old with an abscess in their tooth. And then we have to put them to sleep, take care of all of that. Who wants to go through
No,
that? So prevention.
that's what I'm trying
Yeah.
to help them
Yeah.
avoid. And then
Yeah.
obviously, I mean, they're going to be going every 6 months to their dentist, and they'll just catch that early if it happens. But
Yeah.
as you said, preventing it is better. Is nanohydroxyapatite, is that safe to swallow? Like
I'm okay with swallowing it. From what I can read and what I've seen, I don't see any adverse
yeah,
effects from it being
I haven't
swallowed.
found, yeah,
Unlike, fluoride, if you swallow larger
too
quantities, it
much can
can
be
lead to
toxic.
fluorosis
Hmm.
in development of the teeth, even though the development of the teeth are largely in utero. But yes, you can have excessive fluoride exposure, but I've never heard of excessive nanohydroxyapatite
No, and I
exposure.
put
But
it,
I could be wrong. I haven't read every article on that
no, I
specifically,
haven't
but
found something on that. Okay, well, that's great. So either, again, you can't say one or the other. I try to have all kids have either one or the other, meaning if they really, because it is more expensive, if they can't do the nanohydroxyapatite, we'll do the fluoride drops. And
yeah.
then, as you said, just keeping after those meals or breastfeeding sessions, just wiping them down. And yeah, anything else
I would
you
say,
would add to the,
and also
especially the little one?
when you're looking at formulation, so I think fluoride and nanohydroxyapatite, you have to really research what product you're using. Where does it come from? If you really want the effect of it, like for example, I tried so many hydroxyapatite toothpaste, and a lot of them are garbage. They're so diluted with other things, and they just have
Mhm.
such a small percentage. It's not in the proper shape. The molecule size is way too large. It's not going to fit into those dental tubules. So things like that,
Yeah.
I think, are super important to keep
Oh,
in mind too.
are there
Yeah.
vitamins, for example, vitamin D we give to all exclusively breastfed babies, and we know it helps absorb the calcium in the bones. Does it help with mineralizing the teeth, like vitamin D that we give?
I
I
mean,
just thought.
that's more like systemic, right?
Hmm.
Like the most remineralizing, from what I understand, from what I can remember reading all these articles, is the topical effect
Okay.
is really where we get the most benefit. So we really want to expose our teeth to that
Okay.
topical formulation of the fluoride and
Okay.
hydroxyapatite. And if anyone has questions, you can message me too, because I've researched all the toothpaste on the market. And
I will.
yeah, just it's a
I
lot.
will. It's really important. So our many people don't they find it strange that a pediatrician is talking so much about oral health, but it affects our general health. It all starts from there. And really our gut is it's the same thing, right? Whatever it starts from the mouth and goes, it's the whole
Yeah.
same flora. So anything we put into our baby's mouth from food, from products, it's being absorbed so much. As you know, there's medications we give like sublingual, the
Yeah.
absorption is so good that we give it straight sublingual and it can be absorbed. So they are absorbing everything we give to them: toothpaste, topical ointments, medicated ointments. So we have to be careful what we recommend. But thank
That's
you so
what
much.
I
I have to
know.
go.
Yes, go see
They're
your
gonna start
patient.
knocking
So
on the
good to
doors.
see you. Mwah. Aloha,
Bye.
Dr.
Thank you
Irene.
so much. Bye.
Bye. See you soon.